Hello everyone, let's have a talk about calcifications. So calcification is simply deposition of calcium in your tissues. So it can be either metastatic calcification or dystrophic calcification. Metastatic calcification means whenever you have a high calcium level in your blood and it deposits in different organs of your body which are normal, this is metastatic calcification. And dystrophic calcification is something like whenever you have a normal serum calcium level and it deposits in areas of injury or necrosis, that's called dystrophic calcification. And as the areas of necrosis or injury tend to be localized, the dystrophic calcification also tends to be localized. And one of the most common example is calcific aortic stenosis. So the mechanism behind this goes like this. So first of all, the aorta is the main gateway by which the blood gets out from the heart. So it gets the highest amount of pressure from the heart, directly from the heart. That's why over time the aortic valve curves tend to be damaged. So this is a chronic progressive damage going on in the aortic valve, and this damage is actually accelerated whenever someone has a bicuspid aortic valve, like in Turner syndrome. So that's why there is ongoing damage of the aortic valve, and this damage ultimately leads to necrosis of some cells in the valve, and this necrosis invites calcium, tells it, so I am necrosed, and so come in and fill me. And so calcium comes in and fills up this necrosed area. So there is progressive calcification of the aortic valve. And as you can remember, in case of Turner syndrome leading to bicuspid aortic valve, the aortic stenosis typically occurs at ages like 50 to 60 years of age. But in case of a normal aortic valve getting stenosed, it takes about 60 to 70 years. So it presents after 65 to 70 years. And this is the basic idea here. And you can see dystrophic calcification in case of TB. And in case of TB, you can remember that in case of TB, you have caseous necrosis. So it's kind of a necrosis. So you have the tubercular granuloma, and inside the granuloma there is caseous necrosis, which is surrounded by those epithelioid macrophages, giant cells, Langerhans giant cells, and lymphocytes. And in the center of the granuloma, you have this calcification. And commonly what we see is whenever someone gets a primary tuberculosis, they get a lesion, something called a gone focus. And if they are immunocompetent, they will be able to contain that infection in that lung region, commonly the lower lobes. So that focus of infection ultimately will be calcified, because in the center you have the caseous necrosis. And if you do a chest X-ray in a person who have been exposed to TB and has developed primary tuberculosis, you will see some calcified nodules in the lower lobes of lung, and that's called gone focus. And you can see, as you can remember, you can also see something called gone complex, which is gone focus along with lymphadenitis, which will also be calcified later on. So this will be called gone complex. And tubercular granuloma can also form in pericardium, so obviously it will also lead to development of dystrophic calcification. And whenever someone has chronic abscesses, and inside the abscess you have liquefactive necrosis, because there is apoptosis of neutrophils, which actually causes this liquefactive necrosis. And as this is a necrosis, you will have a dystrophic calcification also there. And fat necrosis. And commonly you have two situations where you have fat necrosis. One is acute pancreatitis, leading to release of lipases in the peripancreatic fat. And whenever there is release of lipases, it's going to break down the lipids. So lipid is actually commonly triglycerides. So if you break down triglyceride, you actually get glycerol and fatty acid. And those fatty acid actually binds to the calcium and forms soap complexes. So it takes up the calcium and form soap complexes, and this is actually kind of a dystrophic calcification. Another common example is if someone has a damage to the breast tissue, like if someone has a car accident And in that car accident, they had some pressure over the breast tissue, severe pressure, which leads to damage of the breast tissue, leading to release of free fatty acid, and those free fatty acids actually invites calcium, and now you have this calcification in the breast. Another common example is infarct, because infarct is simply cell death. So cell death commonly due to ischemia. So if you have cell death, so there is necrosis. Commonly, if it's a solid organ, you will have a coagulative necrosis. If it's something like brain, you will have a liquefactive necrosis. Though in case of brain, you don't get the calcification, but you can get the calcification if there is infarction in other organs. Thrombi. Okay, so thrombus actually, if you think about thrombi, thrombi actually can also get calcified, because and then you can also get calcification in schistosomiasis. Remember that schistosomiasis can occur in the bladder. It can cause cystitis, and after a long chronic cystitis due to schistosomiasis, this can lead to calcification in the bladder wall. And another common example is Monckeberg arterial sclerosis. This is also known as Monckeberg medial calcific sclerosis. This is a damage of the arteriolar wall leading to calcification. And congenital cytomegalovirus infection and toxoplasmosis can also cause dystrophic calcification. Like in case of toxoplasmosis, you get calcification in the brain, and that is actually a classic feature of toxoplasmosis. And you can also get calcification in some tumors, and those are called psammoma bodies. So you can get psammoma bodies in meningiomas, you can get psammoma bodies in papillary carcinoma of thyroid, and also you can get psammoma bodies in serous cyst adenocarcinoma of the ovary. So those are the situations where you get some necrosis, some partial necrosis inside the tumor, and this actually invites the calcium to come in and fill the necrosis area and form those concentric rings of calcification, which lights up as blue when you stain them for calcium stains or basophilic stain. It will light up as blue, and you'll see them, and they are called psammoma bodies. And as I have already mentioned, it is not directly related with serum calcium level. So even if you have a normal calcium level, but you have an area of your body which is damaged or necrosed, it will invite calcium, and the calcium will deposit, forming the areas of dystrophic calcification. Okay, and now let's move on to metastatic calcification. So first of all, metastatic, widespread. So there is widespread calcification because you have a very high calcium, and this high calcium actually deposits in your normal tissues, which is very interesting. And commonly this occurs due to hypercalcemia due to any reason. And one of the most common reason is primary hyperparathyroidism, where you have a high level of parathyroid. I don't know why, idiopathic most commonly, so high level of parathyroid hormone. Sometimes you have parathyroid hyperplasia, sometimes you have parathyroid adenoma, releasing a high level of parathyroid hormones. And these high level parathyroid hormones, they go up to the bone and chews up bone. So there is this actually activates the osteoblasts, and this osteoblast produces rank, which is the receptor activator for nuclear factor kappa beta. And this rank is called a rank ligand. This is a rank ligand. Sorry, my bad. So PTH goes to osteoblast, tells the osteoblast to produce rank L, which is receptor activator of nuclear factor kappa beta ligand. So osteoblast produces rank L. Those rank L goes to the osteoclast, binds to the rank receptor, and after binding to the rank receptor, they activates the osteoclast. So the premature osteoclast now becomes mature osteoclast, and they start to chew up bone. And when they start to chew up bone, they release calcium and phosphate into the tissues, into the circulation. And also what PTH also does is PTH increases calcium absorption in the distal tubule, and PTH also increases the level of active vitamin D, which is 125 dihydroxycholecalciferol, by increasing the activity of 1-alpha hydroxylase in the kidney. So you have high vitamin D, and this high vitamin D also leads to increased calcium absorption from the GI tract, and also increased calcium absorption from the kidney. So you have high calcium level flowing in from your bones, from your intestines, and also you cannot get it rid of by the help of kidney. So your calcium level starts to build up, and this is gonna spread out in the tissues, and it forming the metastatic calcifications. And one of the other common cause is sarcoidosis. So remember, in case of sarcoidosis, it's a chronic granulomatous inflammation, and this is commonly a non-caseating granuloma. And in case of granulomatous inflammation, the hallmark is formation of epithelioid macrophages or epithelioid cells, which are actually activated macrophages. And those macrophages tend to activate the vitamin D. So they have this function of activating the vitamin D, and this activation actually leads to hypervitaminosis D, and this actually causes hypercalcemia. And obviously hypervitaminosis D will also lead to hypercalcemia. And if someone has chronic renal failure with secondary hyperparathyroidism, meaning that first of all, in case of chronic renal failure, there is hypocalcemia, because the reason being, first of all, you cannot excrete phosphate. If you cannot excrete phosphate, it's gonna bind up the calcium, so the free calcium level in the serum will fall. Number one. Number two, if you have chronic renal failure, you do not get the active form of vitamin D from the kidney. So now you cannot absorb the proper amount of calcium from the intestines, and that's why you have a hypocalcemia. And when the parathyroid gland senses this hypocalcemia, sometimes it gets overactive. It senses that it just puts on its emergency button, and it starts sending a lot of parathyroid hormones, causing the secondary hyperparathyroidism, which ultimately leads to hypercalcemia. And another common cause is long-term dialysis. And long-term dialysis can also lead to high calcium phosphate level in the serum, and calciphylaxis or feeding therapy also can lead to high calcium phosphate product levels, leading to metastatic calcification. And the common regions where the calcium deposits are the interstitial tissues of kidney, which is also known as nephrocalcinosis, in the lungs, because lung tissues are soft, gastric mucosa, and those are loose tissue. Those tissues lose acid quickly, and high pH level actually favors the deposition of the calcium. Actually, that ties in with the concept of bone. If you can remember, osteoblastic activity is represented by alkaline phosphatase, right? Alkaline phosphatase. So whenever you have an alkaline environment in the bone, it helps the bone to actually deposit a lot of calcium. So alkaline environment favors the calcium deposition in bone. Same for tissues. Alkaline environment invites calcium to be deposited in the tissues. In opposed to whenever you have an acidic environment, this actually chews up bone. That's why the osteoclasts are most active in acidic environment. Okay, it's gonna make sense, because if you pour acid into a bone, this acid will actually extract the calcium out of that bone, chewing the calcium out of that bone. Okay, and patients are usually not normal calcium, as I've already mentioned. Okay, so here we can see some focus of dystrophic calcification by the yellow star. So this blue region, because calcium is blue in normal common stains. So this is the blue region showing the dystrophic calcification, and and there are thick fibrotic walls around them. But this is the area of necrosis, and inside the area of necrosis you have this deposition of calcium, and sometimes the calcium can form bone-like structures like here. And here you can see metastatic calcification, and this occurs in the alveolar wall. So this is a loose tissue, and they tend to have a more alkaline environment. That's why there is dystrophic calcification, like here. So those are reams of dystrophic calcification. Okay, so that's all about calcification. I think you will be very comfortable about any concept regarding calcification from now on. Thanks for watching my video.